After weathering a stormy hearing before the Senate Finance Committee last week, Health and Human Services Secretary Robert F. Kennedy Jr. is facing calls for his resignation and/or firing. But are the changes and ideas that Secretary Kennedy is proposing as radical as the left makes them out to be? Joining me now to discuss this and more, U.S. Senator Roger Marshall of Kansas, who serves on the Finance Committee as well as the Health Committee. He's an OBGYN who has practiced medicine for more than 25 years, delivering more than 5,000 babies. Dr. Marshall, welcome back to Washington Watch. Thanks for joining us.
Tony, it's great to be with you as well, and I know we got a hot topic today.
Well, let's jump right into it. I know you were on some of the weekend shows talking about this as well. Pretty rough hearing on Friday, but are these changes necessary? Is this the direction we should be going?
I think they are, Tony, and I know that sometimes change is coming really quickly and it's hard for us to accept that, but RFK Jr.'s goals, my goals, are to restore trust and transparency in the CDC. When COVID came along, the CDC, Dr. Fauci lied to us about the origins of the virus. They lied to us about the vaccines as well, overpromised on them. And then the mandates came along. And you were standing beside me, Tony, so thank you for doing that through these years. It's hard that we were back there again. What RFK Jr. is trying to do is to say, look, not every person needs every vaccine. What we want to do is we want to empower parents and their doctor to make decisions together. And personally, I don't think any child needs 76 jabs. Not every child needs every vaccine. And again, we want to restore that trust and transparency in the CDC.
And that's why I am glad you're on the committee, and I'm glad you're out here speaking about this, because I'm not anti-vaccine. I mean, I think, look, I mean, some of these vaccines have saved millions of lives. And so we need to differentiate between what's good, what's bad, or what's maybe not necessary. But as you said, it comes down to the parent and the individual making the decision. I think, Senator, what the big deal is here is that because of COVID, as you pointed out, we don't trust government anymore. And we don't trust doctors, quite frankly, because they were a part of the COVID hoax in many cases.
Yeah, Tony, it breaks my heart. I think just a great example is to talk about the hepatitis vaccine, which the CDC recommends every 1-day-old get this. You know, you mentioned I delivered a baby most every day of my life for 25 years. We tested every one of those moms for hepatitis. If the mom has a negative hepatitis screen, she's not doing IV drugs, she's in a stable monogamous relationship, the chances of that baby getting hepatitis are zero. And so why do we think every baby needs a hepatitis vaccine? And then what is that hepatitis vaccine doing to the development of that baby's immune system? Why do we have all these children with peanut allergies, autoimmune problems, early onset of cancers? You know, we don't know what we don't know.
Right.
And I sit there is, you know, what are the benefits and the risk of this hepatitis vaccine? What are the benefits and risk of a COVID vaccine? And I just think that, again, not every person needs every vaccine.
I think it's wisdom. I think it's right. I think I mentioned I said Thursday. I said Friday. The hearing was on Thursday. I want to go to another topic that came up because Secretary Kennedy rightfully said that these COVID-era telemed allowances were being, protocols were being pulled back. We didn't need that anymore because we don't have COVID. It was an overreaction. But he was asked by one of your colleagues, Senator Daines, regarding what's happening with the abortion pill, mifepristone, where that used to require an in-person doctor visit to ensure that this drug would not do immense damage and possibly death to the mother taking it. But this, I'm just going to read. I'm going to read Secretary Kennedy's response. Senator, I need to get back to you on that. I don't know if the White House has yet taken a position on that. I mean, we've taken a position on the COVID era telemed, but not the abortion pill. It sounds political to me.
Yeah, Tony, this is where we need Family Research Council and your listeners leaning into this one. This is an opportunity. I do think the White House is listening to the situation. But again, this drug mifepristone is, as far as I'm concerned, it's malpractice to give it without a doctor's appointment, without the doctor putting eyes on the patient, without doing a sonogram. If you don't have any idea how far along that woman is, to give this chemical, I think is malpractice. And they use COVID as a disguise to get this done through telemedicine. You know, at some point in time, Americans all of a sudden thought we should just have drive-through medicine. Just like driving through McDonald's, you should just be able to drive up and say, hey, I want my abortion pill. And then that's not, it's not good medicine, and morally it's not the right thing to do either. So I think this is our chance to lean in and say, look, let's require not just a doctor's visit, but let's require a sonogram before these abortion pills are handed out. And I want to make sure your listeners know, like, I've never prescribed this pill. I could never prescribe it, but I've taken care of a lot of patients where other doctors have prescribed it, and I saw them in the emergency room with their complications.
Right, you have, and we've talked about that. By the way, Senator, you know how many times my order's been wrong when I've driven through McDonald's? I need more accuracy when it comes to medicine. Senator, I know you got to run. I want to thank you for taking time to join us, not only for the babies you deliver, but you deliver for the American people on Capitol Hill. So thanks for all your pro-life, pro-family work.
Thanks, Tony. Keep praying for us.
We are, and we will.